All right. Good morning, everyone. We are currently waiting for all of our waiting room to join the meeting for the moment, and we're going to give a couple extra minutes. Welcome to the webinar, which will begin momentarily. Your microphone during this time will be muted while we present and are speaking on the issues. Please turn up your audio and use the Q&A feature to share feedback or ask questions. This session will be recorded and captioned. Captions and recording and transcripts will be posted on the DHCS website within 7 to 10 days. And I, of course, will be repeating myself momentarily for those of you who were unable to fully hear me the first go around. So I'm just going to give it a minute, like I said, and we'll join back up at 10:03 for a simple reminder. Like I said, you will be muted during the presentation of our speaking, and please turn up your audio and use the Q&A feature to share any feedback or ask any questions that you may have. This session will be recorded and captioned. Caption recordings and transcripts will be posted on the DHCS website within 7 to 10 business days. Thank you so much for joining us, and we look forward to presenting with you. All right, good morning, everyone, to the CalAIM Reentry Initiative Learning Collaborative Kickoff session. Welcome to the webinar, which will begin momentarily. As I've now repeated a couple of times, your microphone will be muted while we're presenting and speaking. Please turn up your audio so that you're able to capture everything that we are saying. And then utilize the Q&A feature to share feedback or ask questions at this time. This session will be recorded and captioned. And recordings and transcripts will be posted to the DHCS website within 7 to 10 business days. And with that, next slide, please, we will begin our warm-up exercise for everyone. We actually we have a word cloud, and we request that you utilize the link that's been dropped into the chat feature and start to utilize. We're going to take about 2 minutes. Please add words that you feel, and we're asking, what are you most excited about with the launch of the Reentry Initiative? So go ahead and put your ideas and what you're excited to see in this Reentry Initiative into that word cloud, and we will share that momentarily. All right, we've got some really neat, fun ones popping up on our word cloud as it's starting to kind of go. We have collaboration being one of course, the biggest ones. That's really wonderful. We are also equally excited for the collaboration here at DHCS. We see care, outcomes, access, better connections, success, equity, change, compassionate, service, improve, increase, rates, and hopefully, so it's wonderful to see that change and that excitement from the field and from all of you who are joining us from our correctional partners, our Medicare or partners, or excuse me, Medicaid partners, excuse me, and our managed care plans and our other plans and providers and other stakeholders that are joining us. We are very excited for that collaboration as well. And with that, we can transition over, and I will now introduce our Deputy Director Autumn Boylan, who will be presenting and doing the introduction slides moving forward. Thank you so much for joining us today. And with that, I will transition over to Autumn. Thank you.
Thank you, Michael. And thank you all for joining us for this kickoff session for our Reentry Demonstration Learning Collaborative series. We are really excited to be kicking off this series in partnership with all of you. And we know that it's long overdue. Last year, in October, we put out a 200-page policy guide. Since then, we have done office hours and provided one-on-one technical assistance. But we know that there are still a lot of questions and collaboration opportunities for us as a collective statewide network of partners that are working together to implement this CalAIM Justice Involved initiative. So we're really excited for the opportunities and the promise of these learning collaborative sessions, which are really meant to answer your questions, but also to provide opportunities for us to learn from each other. This is really about hearing from you, letting you hear from each other, identify best practices, collaborate on implementation strategies, and build connections and relationships with other county partners from across the state who are also working on implementation of this reentry demonstration initiative. So we're really excited to have you all here and overwhelmed by the interest and support. We had nearly 500 people register for the event. We have almost 400 people on the webinar this morning, and we know that folks are eager to learn more about this initiative and specifically what you can do to be successful in your county or with our state partners as well. So really looking forward to this collaborative session. The other thing I want to say just at the get-go is that over the course of the last year or more, we have heard all of your feedback and input around the operational model and what actually is going to work for you on the ground and what's not going to work, and how we can improve upon this reentry demonstration to make it more practical and feasible for our county partners to be able to implement this initiative. And so we've really been trying to think through how we can create some flexibilities for this program within the confines of our special terms and conditions and the expectations of our partners at the Centers for Medicare and Medicaid Services. But as you will see over the course of this learning series, we are also thinking about how do we build capacity as a state system? How do we build capacity within a county system without necessarily requiring county partners to be 100% ready to go with every requirement at the most optimal level? So what does a ramp up look like? How do we build capacity over time? And then how does the Department of Healthcare Services monitor your implementation activities over time to ensure that we're aligning with and meeting the goals outlined in our 1115 waiver and special terms and conditions? So we'll start to talk about some of those flexibilities throughout this series and how counties might, start to think about implementing some of those flexibilities. We're working with our federal colleagues to get approval for some specific changes to timelines in our implementation plan, for example, and to be able to allow us to create those flexibilities. We don't have approval yet, but we do expect approval to be coming. But it is all, of course, dependent on approval from our federal partners. So we're going to talk about, some of these strategies, and then we'll communicate out broadly once we have official go-ahead from our federal partners to make some of the changes. We're not going to get into all of those today, but over the course of this Learning Collaborative series, we'll talk about what it's going to take, for example, for county facilities to implement the medications and hand upon release requirement, and what we might need to think about from an operational perspective to make this reasonable and workable for you all. So you can get started with the initiative. We can learn from this demonstration, and then we implement over time to get closer to our vision in terms of meeting the needs of our members. And that's the last thing I'll say before we jump into the content. This initiative is really about our Medi-Cal members, and specifically those members who are incarcerated in state facilities, state prisons, for specifically county jails and youth correctional facilities. And it's about improving outcomes for our members. So when we make policy decisions and we think about operational complexities, we really want to balance the needs of our implementation partners, which is all of you, with the needs of our members to make sure that we are optimizing the experience for our members, able to meet our outcomes and improve outcomes for our members, prevent opioid deaths, prevent homelessness, prevent people from suffering from chronic health conditions when they could get the treatment that they need, both pre-release and post-release, as part of a coordinated reentry strategy and plan for that member specifically. And so at the end of the day, we really want to keep our focus on, member design, person-centered design of the work that we're doing. And we're always open to feedback about how we can improve that member experience through this process. So again, I don't want to hold up the meeting and what we're here for with all of the overview pieces, but we do think that those are important points for you to take away from today's session. On the next slide, you'll see just a little bit about who we are. So this is your Justice Involved team. We have many more people at DHCS that are working on this initiative across multiple divisions and departments within our organization. We also have, of course, our state partners at the California Department of Corrections and Rehabilitation, and we have our partners in each county facility. But we wanted you to at least have a chance to get to know the management team responsible for leading this work at DHCS. So as Michael said, my name is Autumn Boylan. I'm the Deputy Director for the Office of Strategic Partnerships at DHCS, and our team is responsible for implementing the CalAIM Justice Involved or Reentry initiative here at the department. I think many of you have met Sydney Armendariz, but I'll let her introduce herself and then we'll quickly go through the rest of our team. So you can just put a face to the name and make sure that you know who we are and who's here to support you. Sydney?
Hi, everyone. My name is Sydney Armendariz. I'm the chief of the Justice Involved Reentry Services branch. So like Autumn said, I manage the team that is primarily responsible for implementing and operationalizing the Justice Involved initiative. So I'll pass it over to Greg Tate.
Hi, good morning, everybody. My name is Greg Tate, like Sydney just said. I'm the section chief over the Correctional Facilities and Oversight section. I manage Michael Gillis and Mike Kadeen, and I'll send it down to them so they can introduce themselves.
Hi, everybody. Michael Hadeen here. I go by Mike. I'm the Program Support Unit Chief under Greg Tate. Thank you. Happy to be here. I'll pass it over to Michael Gillis, who was already introduced earlier.
Good morning, everyone. Again, my name is Michael Gillis. I'm the unit chief for the Policy Implementation and Monitoring Unit under Greg Tate under the Correctional Facility Oversight section. And with that, we will pass it over to the Reentry Oversight section, over to Luana Welch.
Hi, my name is Luana Welch, and I am the Reentry Services and Oversight Section Chief, and I handle everything that's post-release. So in my section, I have Megan Chandel, and Megan, you can introduce yourself.
Hi, everyone. My name is Megan Chandel. I'm the Policy and Program Support Unit Chief working in the Reentry Oversight section under Luana. And I'll hand it back over to Autumn.
Thank you. This is the awesome team that's been supporting this work here at DHCS, and we would be remiss to not give them a quick shout out for all of the work that they've done, along with all of our partners to stand up this initiative over the last couple of years. So really glad to be introducing them all to you if you haven't met them yet. We're all here to support you, as I said before. On the next slide, we just have a brief overview. I mean, you all know who you are, but this initiative really does span our reentry delivery systems. We have our county and state correctional facility partners, as well as our county behavioral health agencies. We know that there are many county entities at the local level that are responsible for county correctional healthcare services, for behavioral health services, and that you all have different ways of working together. But we're really glad to have all of our county partners here who are part of this initiative, as well as our partners from the California Department of Corrections and Rehabilitation. We also know that community-based providers and pharmacies are critical to this reentry process, and our providers, our reentry providers specifically, are really critical to the success of this initiative, because it is so important that we have community providers that have lived expertise, lived experience, working with this population, being of this population, and helping to support our Medi-Cal members as they are re-entering the community from the carceral setting. So play such an important role in our delivery system. And of course, our managed care plans, our Medi-Cal managed care plans, and our enhanced care management providers are also critical partners in this process. And it's through our Medi-Cal managed care delivery system that we get access to these reentry providers for the purposes of billing the Medi-Cal program. So these partnerships between your county entities, partnerships with managed care plans, partnerships with community providers are critical to the success. And part of what we're going to do today is give you all a chance to talk in your region to the different partners from your area, so you can better get to know each other and build on the relationships that you're already establishing locally. We just told you who we are, and now we want to hear who you are. So on the next slide, we're just going to introduce a quick poll, and we want to know who's in the room. So if you represent a county jail system or youth correctional facility, CDCR, the behavioral health agencies, social services, managed care plans, or providers, please put that, or other, also put that, so that we can get a better sense of who's in the room. It looks like we have quite a lot of participants from our county behavioral health agencies. That's amazing. Glad to have you all here today. And we are going to talk about briefly the role of the county behavioral health agencies and expectations for Go Live. We also have many ECM providers here in the room. Our managed care plans are joining us this morning, as well as our county jail and youth correctional facility partners. So glad to have you all here. And we will continue to work collaboratively with you all and our partners to make sure that we are including people in future sessions that really need to hear the messages and the sessions that we're sharing out over the course of this series. I will also say that we are recording these sessions. We're going to put them up on our website along with all of the materials. We'll send out all of the materials for folks as well. And so we'll make sure that everybody has an opportunity to review the presentation today if they weren't able to participate in the session. Okay, and I am going to turn it over to Jill Michelle from my team, Jill Michael, who's going to walk through kind of what this Learning Collaborative series is all about. Jill?
Thanks, Autumn. So as Autumn said, we're really excited that you're here with us. We have named it a learning collaborative because we're all in this together. We're all learning. And for the much overused adage of building the plane while we're flying it, we are all building this plane while we are flying it. So we're really, really grateful that you could be with us here. Next slide. So this is just an overview of the agenda for today, and I'm going to be taking you through the bigger process in terms of what we're looking at covering. The one thing to keep in mind is, like today when you see Medi-Cal and Provider Enrollment 101, we're really just going to be doing some high policy overviews. There are other very specific trainings for the technical pieces of things like how do you do provider enrollment, how do you do billing, and all of that. So that will be drilled down throughout the whole the entire process. We're really hoping that we can take a deep dive into a lot of the knowledge pieces that people are going to need, and especially, as Autumn said, have people speak to each other about what's working and what's not working. We really need to get some problem solved for our high priority issues and operational issues. We're looking to provide guidance to all of our partners regarding Medi-Cal participation, looking at practices that are implementing best practices, and we're dying to hear about the best practices, as well as strengthen the collaboration between our partners, both the state, in the field, with the correctional facilities, and the managed care plans all the way around. Next slide. So we're going to do a little activity about working norms, our collective working norms. I imagine that you have seen a document like this before. And so I'm actually going to turn it over to Autumn, who's going to share with us how we're going to address this today.
We want to get your input on the collective working norms for this series. So we are going to use a Miro board. This is going to be another brief exercise. And we want you to be thinking about what else should we consider to be our working norms. We really, thought that we have a good starting place, but we want your input because this is not DHCS's working norms. This is our collective working norms for all of us to agree to in terms of how we are going to function within this learning collaborative series environment. We want you to, be solution oriented. We want to not just identify problems, but work collaboratively together to identify solutions. We want to be thinking about our cross-sector partners and the whole delivery system infrastructure and how we come together as a system to support our members, and not just from your own perspective and lens. We want you to be curious and ask questions and try to understand some of the policy and seek understanding as you go through this process. But what do you want out of this Learning Collaborative series? And we just put some links in the chat. So according to your last name, just so we don't have an overload like we did with the poll EVB, please click on the Miro board that aligns with the first letter of your last name, and then share with us any edits, additions, or any other changes that you'd like to make to our collective norms. And then we'll put that all together before our next session to better reflect the thinking of this collective group. So we'll give you just a moment to do that before we move on to the next segment. And it looks like we're having responses starting to come in. We have some suggestions around providing example feedback, and sorry, I'm trying to look and see as we go, but folks are adding your board. Oh, here, so we actually forgot to say this part. So you can grab a sticky note in the Miro board, and it will pop up a note like you see there, example note, and then you can just edit it, change it right there. You can also zoom in and zoom out. So we want to use our time efficiently and stay focused. We want to be direct and share clear information about workflows and logistics. We want to have a repository of resources, and we're building that for sure. We want to make sure, sorry, I'm trying to read some of these off as we go. I realized I read out the example note. That was silly, but want to make sure that we're hearing from folks. There's lots of activity. I see lots of cursors and people moving around the Miro boards. We want to connect after the collaborative for any follow-up items, and we'll talk about the process for how we're going to do that, which is going to be through a series of office hours. So next week, there will be an office hours session. If you have questions following today's Learning Collaborative session, you can join us for the open forum office hours session next week. There's also going to be other ways in which we provide information out following these sessions, including FAQs and other things. We want to share best practices. and we want to make sure that we're being respectful of other people's viewpoints and perspectives. So lots of activities still happening in the Miro boards. This is great. We're going to take all of this feedback and update our working norms so that they do represent us as a collective group. And Jill, I'm going to hand it back over to you now so that you can keep going through the Learning Collaborative, but feel free, folks, to continue adding to the Miro board throughout the session. They'll be open throughout this session today. And so we're going to go ahead and keep moving, but we encourage you to continue to contribute to the conversation.
All right, let me get back. Here we go. So thanks, Autumn. It's really interesting to see what people are hoping for with this this initiative. And as I said, we're all really excited to get it going. So here's a little bit of a timeline about what we're looking for with our Learning Collaborative process. Today, you're on August 22nd. We're at the kickoff. And you can see in the blue squares, we basically have session 2, session 3, etc. Some of the sessions may change the content, we may switch it up a little bit if we have to, or we have a lot of questions about one thing, or we realize you really want to do this first. So some of the sessions may change in terms of the sequence and some of the content, but overall, this should give you a pretty good sense of what we're talking about here in the different sessions. If you'll notice down here at the office hours, for each session that we have a companion office hour that's a week later. And then you can bring your questions about the session or other questions too. As Autumn said, we want as many questions as we can so that we can answer them. So the office hours are right below the blue squares that talk about what the session has. We're going to be continuing this into 2025, which sometimes seems very far away, and then it's just a blink. And then on the bottom, I just wanted to show you, we have 2 special trainings. One of them is for the JI screening portal, and this is a technical training. And those are the dates that the trainings are. They are 2 separate trainings, so you can attend either. You don't have to go to both, you just pick a session. And that's also true for the billing training. The 17th, 18th, and 19th, they are all separate sessions, and you can choose one that works best for you. Next slide, please. And now I'm going to be handing it off to my colleague, and I think it's Autumn or Sydney. You ready, Sydney? Here we go.
Thank you so much, Jill. So hi, everyone. Again, I'm Sydney Armendariz. I will give an overview of the California Reentry Initiative. So next slide, please. So our goals for our reentry initiative, we have about 5 primary goals. The first is to increase coverage and also improve the continuity of coverage and service uptake by assessing eligibility and also looking at the availability of coverage for benefits in carceral settings prior to release. The second goal is to improve access to services prior to release, which will then help to transitions and continuity of care into the community upon release. The third is to provide behavioral health intervention and use medications to stabilize for stabilization, and addiction treatment for substance use disorders, with the goal of reducing decompensation, suicide-related deaths, overdoses, and overdose-related deaths in the near term post-release. The fourth goal is to improve coordination and communication between correctional systems, Medicaid, and CHIP systems, managed care plans, and community-based providers. One of those is our Learning Collaborative that we're doing today. That's an example of that goal to improve coordination and communication. And lastly, we hope to reduce post-release acute care utilizations, such as emergency department visits and inpatient hospitalizations. And we hope that we can help stabilize and manage serious physical and behavioral health conditions, and that would lead to increased receipt of preventive and routine physical and behavioral health care as well. Next slide. So our CalAIM Reentry Initiative is comprised of several components, taking you through pre-release and then also throughout the individual's reentry back into the community. So the first puzzle piece on this slide is our pre-release Medi-Cal application process. That went live January of 2023. That required all county correctional facilities to provide Medi-Cal applications to incarcerated individuals to help them enroll in Medi-Cal prior to their release so that they can then access Medi-Cal services post-release. The second puzzle piece there is probably the largest chunk of this is the 90-day services pre-release. That's our 1115 waiver. That is where county correctional facilities, youth correctional facilities, and state prisons will provide Medi-Cal services in the 90-day period prior to the individual's release. That feeds into behavioral health links, which links people to county behavioral health services post-release. And then we have our enhanced care management for the justice involved population of focus that went live January 1st of 2024. And that is a new Medi-Cal managed care benefit that provides a robust set of Medi-Cal managed care services for certain populations, and the justice involved population is one of those focuses. Lastly, the last two puzzle pieces on this slide are community supports and justice reentry and transition providers. And so that's looking at partnerships with community-based organizations and justice reentry providers out in the community who have credibility and with working with this population, who have experience working with this population to help provide some social support as well. Next slide, please. So the eligibility criteria for the pre-release services. So incarcerated individuals must meet the following criteria to receive the 90-day services prior to their release. So first, they must be a part of a Medi-Cal or Children's Health Insurance Program CHIP eligibility group. And they must meet one of the following healthcare need criteria that's listed here on the slide. So that can be mental illness, substance use disorder, chronic condition or significant clinical condition, intellectual or developmental disability, traumatic brain injury, HIV or AIDS, or are pregnant or postpartum. And an important note for the eligibility criteria is that all Medi-Cal or CHIP eligible youth who are incarcerated in a youth correctional facility or under 21 and incarcerated at an adult jail, or are considered a former foster youth under 26 and incarcerated at an adult jail, they are eligible to receive pre-release services and do not need to demonstrate a healthcare need. Next slide, please. So the services that are covered in the pre-release period, so the 1115 demonstration waiver covers services such as reentry care management services, physical and behavioral health clinical consultation services that can be provided through telehealth or in person, laboratory and radiology services, medications and medication administration, medication-assisted treatment or medications for addiction treatment, also known as MAT, and services that are provided by community health workers with lived experience. In addition to these services, qualifying individuals will also receive covered outpatient prescribed medications and over-the-counter drugs. And we do require a minimum of a 30-day supply as clinically appropriate. And we also will provide durable medical equipment or DME upon release, and we'll provide DME that is consistent with our Medicaid state plan coverage authority and policy. Next slide, please. So I believe I'll pass it to Autumn to give an overview of Medi-Cal.
Thank you so much, Sydney. All right, so we wanted to share just a little bit of information about the Medi-Cal delivery system for some of our county correctional facility partners, so you can better understand kind of what it means to be a Medi-Cal provider and how you can enroll as a Medi-Cal provider, which is one of the very first steps in the process for going live. So we're going to walk through just a little bit of an overview here today to answer some of the questions that we know that you have around provider enrollment and NPI numbers and all of those pieces. So next slide. So basically, the Medi-Cal program provides free or low-cost healthcare coverage for individuals in the state of California. There are eligibility requirements that our Medi-Cal members must meet in order to be eligible for the Medi-Cal program, meaning that they must meet some income thresholds and asset pieces. And the Medi-Cal program is authorized through a partnership with the Centers for Medicare and Medicaid Services. And there are specific guiding documents that really govern the Medi-Cal program specifically in California. We have a Medi-Cal state plan, for example, as well as a Medi-Cal provider manual that kind of details all of the services, billing requirements, practitioner requirements that are outlined in our state plan. So the state plan is one level, and then the provider manual provides a deeper dive view into all of the services and programs that are authorized as part of our Medi-Cal state plan. We also have waiver programs that authorize specific services under both what's called a 1915B waiver, which is how our managed care and behavioral health delivery systems are authorized, as well as an 1115 waiver, which is really what is a demonstration waiver. We renew those demonstration waivers every 5 years, and the reentry demonstration waiver to allow for Medi-Cal billing of services provided to individuals for that 90 days period of pre-release is authorized through an 1115 waiver. We also have different delivery systems within the Medi-Cal program that are the ways in which we cover services for our Medi-Cal members, including our Medi-Cal fee-for-service delivery system, which is not under our Medi-Cal managed care infrastructure. It's separate. And so all of the pre-release services that we are reimbursing under this waiver program are part of that Medi-Cal fee-for-service delivery system specifically. On the next page, there's a little bit of an overview of the different delivery systems that are relevant to the reentry demonstration initiative, which is inclusive of our fee-for-service delivery system, which I just spoke about. In this system, the Medi-Cal providers enroll with the state and provide state plan covered or waiver services that are authorized by the Centers for Medicare and Medicaid Services. The services have to be medically necessary and are reimbursable on a fee-for-service basis based on the Medi-Cal fee schedule, and we'll talk to you a little bit about that. And there's also Medi-Cal RX reimbursement policy for pharmacy claims as well. So both the Medi-Cal provider manual and the Medi-Cal RX provider manuals are important documents for our correctional facility county partners to be familiar with related to the services that you are providing in this pre-release setting. And we will have some sessions to specifically go into how to read those documents and how to bill for services and some of the rules around billing and claiming, but it's important for you to understand where to find information, which is all available on the DHCS website. We also have our managed care delivery system, which is where we have authority to provide the enhanced care management benefit. It's also through our Medi-Cal managed care plans and their provider network, so all of their contracted providers that are how we provide community support. So some of those important community supports like housing navigation services, the medical respite programs, homemaker services are those services that are offered by our Medi-Cal managed care delivery system. And for community support specifically, those are opted in by our Medi-Cal managed care plans. But the enhanced care management benefit is a statewide entitlement benefit for members that meet the service criteria eligibility requirements for our ECM benefit. We also established policy through our contract with the Medi-Cal managed care plans and all plan letters where we issue guidance to our MCP partners about the implementation of various programs and initiatives, including the pre-release services CalAIM Justice Involved initiative. And we have a separate behavioral health delivery system where our county behavioral health agencies provide medically necessary specialty mental health services, drug Medi-Cal organized delivery system, or drug Medi-Cal state plan services. And policy is established through our contract with the counties, as well as the state statute regulations and information notices. There is a shared responsibility for mental health services between our managed care plans and our behavioral health delivery systems. And so the Medi-Cal managed care plans provide non-specialty mental health services for members with more mild to moderate impairments. And our county behavioral health agencies provide mental health services to individuals who meet criteria for those services, particularly for specialty mental health services. And those are usually individuals with a higher level of need and more persistent and severe mental illness. Although there's a lot of work that we've done through the CalAIM initiative to really think through medical necessity, both for children and adults. And so we'll get into kind of the which delivery system is responsible conversation when we talk about behavioral health services in one of our upcoming sessions. Next. Through the reentry demonstration waiver, Medi-Cal providers that are enrolled in our fee-for-service delivery system will claim for services or provide services through different networks. So for correctional facilities, which includes their embedded providers or providers that work directly for the county or for the state, or contracted entities that are working on behalf of the correctional facility to deliver correctional healthcare services to individuals who are incarcerated in the facility, can provide all of those pre-release services, but also community-based providers who are operating on an in-reach basis can also provide those services. Community health worker services can only be delivered through an in-reach model, whereby a community provider goes into the facility or provides those services via telehealth. But the connection to community health worker services is very important to the success of these programs, and we encourage correctional facilities to creatively think through strategies and opportunities to kind of rethink the way that you think about people with lived experience and the importance of the role that they play in the overall delivery system. Next. We do want to also make sure that all of our correctional facility partners and county partners are tracking some of the expectations around provider enrollment specifically. For every facility, county facility, every state prison, county jail, and youth correctional facility must be enrolled with the state Medicaid agency, that's DHCS, as a Medi-Cal provider through our PAVE portal. We have a specific enrollment pathway for our county facility partners through the exempt from licensure clinic enrollment type. And we're going to talk a little bit more about that and point you to information about how to enroll as an exempt from licensure clinic. But we want to note here that it is required as a prerequisite for any reimbursement under the Medi-Cal program that the county correctional facilities are enrolled, and same with our CDCR facilities as well. So speaking to the county piece for just a moment, the enrollment is county entity specific. So only one provider enrollment is required per site. So you don't need both the sheriff, for example, sheriff's office and your county Department of Public Health to enroll if it's the county Department of Public Health that is responsible for the correctional healthcare services in your county. You only need one county entity, and it should be the county entity that is primarily responsible for correctional healthcare services, that is the enrolled entity. The enrolled entity at the county level will oversee all of the billing to DHCS. You can utilize contracted providers, third-party billers, to help assist the county entity with the specifics of the billing, but that county entity will be the enrolled entity, will have the MPI number that's required, and all of the claiming will be submitted through that county entity's MPI number. It is also required that all pharmacies, including correctional facility on-site pharmacies, are enrolled in the Medi-Cal program, or that any community pharmacies that are being utilized for meeting the requirements for the pharmacy benefits available to our pre-release population, that they are enrolled in the Medi-Cal program as well. So again, the enrollment is location specific in this case, and only one pharmacy enrollment is required per site. But there needs to be enrollment separately for the pharmacies. So the correctional facility and the pharmacy both have to be enrolled if there's an on-site pharmacy in the correctional facility setting. Next. So how do you enroll? So clinics, providers, and pharmacies, so including our correctional facility partners, enroll through the Medi-Cal fee-for-system provider application and validation for enrollment, or PAVE system. We have a step-by-step walkthrough of the PAVE enrollment for exempt from licensure clinics, and there's tons of information on our website about pharmacy enrollment, and both of those are linked on this page, as well as at the end in a resource page. So correctional facility county entities that are going to be the enrolled entity should submit your Medi-Cal enrollment applications at or around the time that you've submitted your readiness assessment to DHCS. So for those of you who are slated to go live in October or January, if you have not yet begun the process to enroll through our PAVE system, please do so, and we'll work with you to help support you to get that done. But for any other county entities that are thinking about going live in March, for example, you would enroll when you submit your readiness, or April, I should say. You would enroll when you submit your readiness application, and same thing going forward, that you would enroll at the same time that you submit your readiness application to DHCS. Next. Just a little bit more information about enrollment. There is a requirement for the correctional facility to obtain a national provider identification number. There are two types of NPI numbers that are important for you to understand. The first is the agency level, which is a type 2 NPI number. So facilities within an agency can apply as an organization, and then individual pharmacy sites also need their own unique NPI number as well. Individual practitioners that directly provide the services to the enrolled members within the correctional facility setting or with a community-based provider must have a type 1 NPI number for billing purposes. And that type 1 NPI number needs to be on the claim as well as on referrals and prescriptions, et cetera. So and that applies to ordering, referring, and prescribing or practitioners or practitioners. So physicians, nurse practitioners, physician assistants, licensed clinical social workers who make referrals, physicians who order supplies or items such as DME or laboratory or x-rays, for example, or prescribing practitioners who prescribe medications need to have a type 1 NPI number. Next. You can obtain an NPI number. It's pretty easy. Anybody can do it. It takes typically about 20 minutes or so to complete the NPI application, and you can apply online or by mail. We do suggest you do an electronic application online through the National Plan and Provider Enumeration System, or NPES website. We've linked out to the NPES website here, and there's also on the NPES website frequently asked questions or other helpful information that will help you determine what is the appropriate inputs in terms of you have to select a taxonomy code, for example, and you would be able to get information about which taxonomy code to select by looking through the information on the NPES website. There are over 800 taxonomy codes to choose from, and you must select one as the primary. Although you can have multiple, there must be one that's the primary taxonomy type. We do recommend, although it is not up to us to decide, it is ultimately the responsibility of the County Correctional Healthcare Services entity to make this determination, but there is a taxonomy code for prison health clinic or center, which could be a good option for our county correctional facility partners to select in terms of taxonomy. But please do look through the available taxonomy codes to determine if there is a better option for your entity. Next. So as I said, on our website and linked in the presentation today, there's a specific step-by-step enrollment instructions for correctional facilities to enroll as an exempt from licensure clinic. We just put a little screenshot of that but it's a detailed step-by-step instruction guide to help you manage the enrollment process. And it has screenshots of every screen and input and gives lots of direction. We suggest that you take a look at that and then follow that direction and guidance as you are enrolling for your county correctional facility entity. Next. There are mandatory provider enrollment fees required under federal law. So for all provider types to apply for Medi-Cal, to be a Medi-Cal provider or Medicaid provider anywhere else in the nation, federal law in the Code of Federal Regulations requires state Medicaid agencies to charge a fee. Applicants who are requesting enrollment as an exempt from licensure clinics, so our county correctional facility entities, will have to pay an application fee of $709 for calendar year 2024. Government agencies, as would be all of our exempt from licensure clinics in this context, are required to pay the application fee and may submit it via check or through a cashier's check. So you don't have to do the ACH payment or electronic payment. You can actually, still do the enrollment and then send a check to the department. And you are allowed to use PATH funding to pay your enrollment fee. So if you have not yet received your PATH funding or not yet applied for PATH funding, that funding is available to cover the cost of the enrollment fee, which again is $709 for this calendar year. Every year the fees are assessed. Sometimes they change. It might be $709 next year. It might be $712, but it's a fee that you have to pay when you initially enroll in the Medi-Cal program. Next. We also wanted to make it very clear that ordering, referring, and prescribing practitioners in the Medi-Cal program are also required to separately enroll as ORP-only providers in the Medi-Cal program. So under Medicaid law, again, at the federal level, these are federal requirements. All ordering providers or practitioners, so practitioners who request service or items to be provided during pre-release, such as ordering diagnostic tests, DME, or supplies. All prescribing practitioners, so if you prescribe medications or DME, or referring practitioners, so this is a provider who directs the patient to care to another provider that is rendering the services. So for example, if you have a primary care provider that is referring to a specialist, or you have an intake provider who is then making a referral to a treatment team within the facility, that is a referring provider. Only providers who serve in this role that have a Medi-Cal enrollment pathway are required to enroll. But if there is a Medi-Cal enrollment pathway, such as physicians and nurse practitioners, LCSWs, LMFTs, for example, they must obtain a type 1 NPI number and enroll. And we've included, it's a very easy enrollment process. It's not as lengthy as the facility enrollment. There's only a few questions, but there are step-by-step enrollment instructions for ORP providers included in the deck. And again, we will be sharing out all of these slides and all of this information on our website as well as the recording. Next. We did get, as part of our 1115 waiver, some flexibility about this rule, but I will say that CMS is very nervous about California implementing any waivers of these requirements. It's not allowed in any other context, and they didn't like it and wanted to undo it, frankly. And so we wanted to be very careful with our application of any waiver options for these ORP requirements. But we did hear from county and state correctional facility partners that we might need to think about a waiver to account for specific circumstances in specific counties or with our state partners. And for those of you with the Department of Corrections and Rehabilitation, this slide is very much focused on county entities, but we will be working directly with you on potential ORP waiver criteria for our state partners. So for our county partners, we will consider proposals from correctional facilities to waive the enrollment requirements, but only for referring practitioners. So all ordering and prescribing practitioners must be enrolled. There's specific program integrity requirements related to these practitioner types, and the concerns around program integrity from our federal partners and from CMS as the state Medicaid, from DHCS as the state Medicaid agency, are really around kind of the ordering and prescribing pieces. But we will consider waivers for referring practitioners that are county employees or employees of the correctional facility entity. So the sheriff's office, probation, county public health, your county Department of Health Services, whoever is responsible for providing at the practitioner level correctional healthcare services. If they're referring only practitioner, we will consider applications for a waiver. However, we want the correctional facility in those circumstances to meet at least one of the following criteria: be a HRSA designated provider shortage area, a smaller rural county, or have a demonstrated labor contract limitation. We did hear that there were some labor issues and potentially some hardships around correctional facilities requiring their employed providers to enroll in our system, and so we will consider that in terms of the reasonable justification for such a waiver request. We will not entertain waiver proposals for contracted entities that work with the county to deliver correctional healthcare services. If you would like to request such a waiver for your referring practitioner, so for example, if you have an LCSW that is referring to a psychiatrist for medication therapy or to a physician, that could be an example of a type of practitioner that you might request a waiver for. It's just one example, but it is one of the examples that we wanted to share. You can submit a written request to DHCS that includes a detailed justification with documentation supporting your rationale for requesting the waiver. We want to know the list of practitioners subject to the waiver request, as well as the requested duration of the waiver. Is this a temporary waiver or a long-term waiver? And we want to know the correctional facility county entities plan to mitigate program integrity risks, including how you will monitor these practitioners who are exempted from this enrollment requirement, as well as any other information that is required by DHCS to make a determination. Next. We also wanted to make sure that you have some information today, although we will provide specific training around billing within the Medi-Cal program on some future dates. And Jill went over those a little bit earlier, but we will make sure that we are sharing that out again at the end of today's session. But all of the services, we've had a lot of questions about billing. So for services reimbursable in the pre-release setting, these services are available on our Medi-Cal fee schedule, or we have the care management bundles. We also have some behavioral health codes that we're going to be providing some specific guidance about that will be billable as well. But a majority of the codes for services, including your health risk assessments, your screenings, your services for individuals with chronic healthcare conditions or pregnant and postpartum individuals, are all actually already publicly available on the Medi-Cal fee schedule. And you can look through the Medi-Cal fee schedule to identify the specific categories of services that are reimbursable under the waiver program. So when you pull up the fee schedule, it's basically an Excel table with a bunch of data in it, but the things that are important are looking for the procedure codes, and there's different types of codes in the fee schedule. There's a service description, there's eligible practitioners, and a basic rate that is the reimbursement rate for those services. So if you're providing physical clinical consultation for a member with diabetes, for example. There are specific physician codes that you would bill, and you can start to look for the information. There will be a much more detailed provider manual and training process, and those dates are scheduled for September for you to have that information. But we want to make sure that you can start to orient yourself to this fee schedule. Next. All right, I am going to turn it back to Michael Gillis. I'm going to go back to the Q&A in the chat and start to answer some of your questions there, because I know that there's been a lot of questions coming in, and we thank you for the questions, but hopefully this has been helpful. Michael?
Absolutely. Thank you so much, Autumn. And thank you, everyone. We will be now turning the page onto our readiness assessment application and go live requirements. So for our first area, our correctional facility readiness assessment requirements. All prisons, jails, and youth correctional facilities are required to demonstrate readiness to participate in the Justice Involved Reentry initiative and receive DHCS approval prior to go live with pre-release services. Readiness assessment applications consist of the readiness checklist and supporting information, the readiness assessment attestation form, and the go live date requested form. All correctional facilities are required to submit this information at least 6 months prior to its requested go live date and demonstrate its readiness to provide pre-release services and behavioral health links. It's important, like I said, to note that those are the 3 parts that make up the readiness application. Readiness assessments will be conducted on a quarterly basis and focus on the 5 key areas. Readiness decisions and approval will for go live will be made at an individual facility level. So it's a really important note. Overall, we're not going to be doing it on a county-based level. We are doing it based on our overall individual facility and then which of the facilities you will be reporting readiness. So if you ever get a follow-up request from us because you didn't provide which facilities, that's why we are just going to clarify and make sure that we have all the information that we may need. Next slide, please. Our correctional facility readiness assessment requirements. The 5 requirements are our Medi-Cal application process, our 90-day pre-release eligibility and behavioral health link screenings, our 90-day pre-release service delivery, our reentry, planning and coordination, and then finally our oversight and project management. So this is ultimately these 5 focus areas will help us be able to see that the correctional facilities are indeed providing full coverage within the 1115 waiver, and we greatly appreciate your guys' participation in this. Next slide, please. All right, the correctional facility go live checklist. This is a checklist to provide a DHCS with the information from the correctional facility. You are enrolled as a Medicare provider via the provider application and validation form found at the link below. You have reviewed and completed the items listed in the new provider checklist found at the link provided from our CAMUS partners from DHCS. You have completed the JI screening portal training and 90-day pre-release training available at the Medi-Cal learning portal at our Medi-Cal learning page. More information as well will be forthcoming about the screening portal as we deliver it and provide it from DHCS. If the correctional facility receives a conditional approval, complete outstanding readiness activities and report status updates to DHCS upon completion. So it's important to note that if provided a conditional approval in any way or any of the previous slides focus areas, that DHCS will be continuing to engage in a monitoring exchange back and forth with the correctional facilities. Next slide, please. Correctional facility provider and practitioner list. Prior to go live, then periodically thereafter, county correctional facilities are required to submit to Department of Healthcare Services in a specific format, a provider and practitioner list with details, specifically the county correctional facility project administrator, the embedded ORP practitioners, county employees that will order, refer, or describe Medi-Cal services during the pre-release period as described by Autumn Boylan previously, the embedded providers and practitioners contractors, entities that are providing specific services on behalf of the correctional facility, the ORP practitioners and embedded contractors, entities, and then finally provider organization and practitioners approved by the correctional facility to provide in-reach services. And with that, I'm actually going to turn it over to our behavioral health readiness assessment team, and that will be Megan Shandell. Thank you so much for listening to me talk about our correctional facility readiness assessments. Thank you all.
Hello, everyone. So the Behavioral Health Agency Go Live Checklist, County Behavioral Health Agency assessment applications were due to DHCS back on April 1st. As of right now, we have received every single one of the Behavioral Health Agency's readiness assessment applications. And just wanted to note that all county behavioral health agencies are expected to go live with behavioral health links on October 1st of this year. So some next steps, after you have received your scoring on your application, most counties should have received that by now. If you have not, please reach out to us at our email inbox. Somebody will drop that into the chat right now as well. So the next steps would be to enroll as a Medi-Cal fee-for-service provider via the provider application and validation for enrollment system or the PAVE system. There is a link right here on the page. The last slide of this webinar presentation will also have that link available. And then if the behavioral health agency attested that they are not yet ready, but will be ready by 10/1, the agency must complete outstanding readiness assessment activities and report status updates to DHCS prior to their go live. And then finally, you will need to complete the JI screening portal training and the 90-day pre-release trainings available in the Medi-Cal learning portal at the link on the screen and also on the last slide of this presentation. So next slide, please. So Behavioral Health Agency Go Live expectations. We recognize that we are 40 days away from October 1st of this year. So we wanted to provide some clarification on what to expect, what we are expecting of behavioral health agencies, and some to inform your next steps. So if the county correctional facilities are not going live with pre-release services on 10/1, if you are the county of responsibility, you are required to receive a behavioral health link, which will consist of data exchange, clinical consultation, warm handoff, reentry planning from other counties or state entities that are live with pre-release services. And then you can refer to our policy and operation guide, section 11.4 for some more information on behavioral health links. DHCS has also posted a correctional facility readiness dashboard to our Justice Involved Initiative webpage, and that will be your go-to location to see what correctional facilities are in the process of review, what their requested go-live date is, and if they are approved to go live on that date. You will also be expected to cover medically necessary post-release specialty mental health services, DMC and DMC ODS services to formerly incarcerated Medi-Cal members that meet the criteria. Ensure adequacy of behavioral health network providers to meet the need for reentry, and that would include both in-reach and post-release, although in-reach services will only be provided within your county of operation once your correctional facilities go live. And then collaborate with the county correctional facility to plan for county go live of pre-release services. If your county correctional facilities are projected to go live with pre-release services on October 1st, you will be expected to receive the behavioral health link consisting of the data exchange, clinical consultation, warm handoff, and reentry planning from that county correctional facility. Provide pre-release in-reach mental health and substance use disorder services as applicable, cover medically necessary post-release specialty mental health services and DMC ODS services to formerly incarcerated Medi-Cal members that meet the criteria, ensure adequacy of behavioral health network providers to meet the need for reentry, both in-reach and post-release, and then to collaborate with the county correctional facility to plan for county go-live of pre-release services. Next slide, please. With that, I believe I'm handing it back over to Autumn.
Nope.
Oh no, handing it to Greg Tate. Sorry.
Oh, thank you so much, Megan. Appreciate you. All right, everybody. So now it's time for us to have a little breakout session. We're going to do the managed care plan and correctional facility coordination breakout session. Next slide. There are going to be 6 rooms that we're going to have. If you look at the corresponding slide here, it should tell you which room that we would suggest that you go to. There's room 1, which is the Northern 1 room with the partnership and the counties that are listed. I don't think I need to go through each of them. You guys should be able to see them. Then we got room 2, which is Northern 2, room 3, Central 1, room 4, Central 2, room 5, Southern 1, and room 6, Southern 2. In each room, you'll have a corresponding representative from DHCS OSPJI team, a manager, and a staff member that will be scribing to take notes on what we're going to be discussing in there. There'll be a prompt that we'll give you guys. It's your opportunity to communicate with each other and have some conversation versus just listening to us go through the slides. Next slide, please. The breakout rooms will be listed momentarily. I'm not sure if they're up yet, but they'll be listed soon. And if there's any technical assistance with the breakout rooms, you can just reach out to us and let us know. When the breakout rooms open up, you can select which room that you're going to join. So you join your breakout room from the previous slide and we'll have it up so you know which room you're going to. If you don't see a breakout room or anything on the bottom of your screen, click more and it should be able to allow you to select the room. And if the window opens and the room is listed, then you should be able to locate your room, click on it, and confirm that you're going to go to that room. If you're experiencing any technical difficulties, please reach out to one of the hosts and we will try and get you into the correct room. So at this time, I'm going to go back to the slide previous so we can see which room you're going to be in. And we suggest that you move to your suggested breakout room. Thank you so much. See you guys there.
Okay, we have everybody coming back. We're just going to give it a few more seconds while folks filter back over from the breakout sessions. And we are going to just kind of talk through one more piece, and then we're going to take a little break while folks take your time to complete an activity. So you'll have a moment to stretch before we close out and do a wrap up for today's session. But wanted to just kind of bring everybody back together and centered back around some of the, if we could go to the next, maybe go to slide 42. Thank you. Want to just center around like some of what we'll be covering in this Learning Collaborative series. Next topic. Or next slide, sorry. Some of the things that we've heard are areas where we know that you still want more information from us, that we can dig a little bit deeper. We're going to cover all of these topics in forthcoming learning sessions. There's additional guidance coming out, including billing guidance, but we know that there are particular issues that are rising to the top as challenges or areas where we should spend some time and focus on discussions around best practices and strategies for implementation. And so we're going to use this learning series to walk through all of these sessions, but we want to be able to hear from you today. And this is going to be, I'm going to introduce the activity, and then we're going to give you a chance to kind of spend some quiet time thinking about the questions that you want to make sure that we're addressing in this series. And so we're going to kind of go on break while folks complete that next activity. Don't go on break yet. I'm going to give directions in just a moment, but we know that there are still issues related to pharmacy policy, meds in hand, how prescription claims are generated in your electronic health records. We know that there is still a lot of unease about unpredictable release dates and the short-term model and how folks are managing to the circumstances that are the reality on the ground, that many or most people who are in custody in adult jails, for example, are in and out in less than a week. And what can you really accomplish? What are the expectations and what, during that period of time? So our next session actually is going to focus on that. And we're going to bring in some of our county partners that'll be going live in October to talk about the ways that they're thinking about it. So these sessions will also bring folks together to share some of their learnings, not just so you can hear from DHCS. We know that there's still a lot of questions about billing, and we've got some billing training coming up, but we want to make sure that we're answering your questions in those trainings. And so what we're going to ask you to think about today is like, what specific questions do you have besides where are the codes and when are you going to release the guidance? But what do you want to make sure that that guidance covers? There's still questions about care management bundles and provider capacity. We know is a concern for correctional facility partners. If you're doing your part, but there's not a robust network upon pre-release, like whose responsibility is that? We're going to cover some of those things. But there's dual and shared responsibilities of our correctional facility partners and our managed care plans. And so, you know, we're holding the right parties accountable for your part of that puzzle that Sydney talked through earlier today. We're going to dive deep into warm handoffs and ECM, but we know there's still a lot of questions related to that. Some questions I just heard in our breakout session were around the MCP auto assignment, so we'll make sure that we're sharing some additional information about that, and the provision of MAT treatment, as well as behavioral health links and kind of all of the things. So what we're going to do is ask you to share your specific questions. So there's going to be another Miro board activity. We want to know, what is it that you want us to address? What are your questions in these areas? And there is a link that we're going to put in the chat that you can click on the topic or the Miro board for the topic that you're most interested in. Christian's putting them in the chat right now, and you can jump around, but we want to hear from you. So again, just a reminder, on the next slide is the reminder about how to use the Miro board. You can create a sticky note where you can write your question or your comments. You can zoom in or out using the control panel, but you can grab your sticky notes and add as many as you'd like. You can adjust the font size and put in your questions, and we'll make sure that we try to address your comments and questions in our future sessions going forward. So while we're doing this activity, we're all going to go on a little break and a little journey of reflection in these areas. And if you go back to the prior slide, you'll see the topic areas. And we'd ask you to spend about the next 10 minutes or so telling us what questions you have, and then we'll come back to the group and wrap up for this first session today. So click on the link that you're most interested in. We're here to provide technical assistance, but we're going to take the next 10 minutes for folks to complete your Miro board exercise. All right, thank you all for your thoughts, your questions, and the Miro boards. It'll really help us shape this Learning Collaborative series. So we'll give folks just a second to kind of come back and close down the Miro boards. You can continue to ask your questions, send your questions to us. There'll be an office hours session next week. So bring your questions there as well. And then we'll be putting out FAQs based on kind of all of the questions that we receive from you over time. So we'll build on that. So not every question will be answered in the first iteration, but we'll iterate. It'll be a live document and it'll grow over time. Let's go to the next slide. And I think we just did this, so we're going to skip past this piece and go into a wrap up with the few minutes that we have left. I think this was a very productive session. We know that there was a ton of information provided for you today. Hopefully the breakout sessions were productive and you were able to have some dialogue about collaboration or the Justice Involved initiative or kind of some of the things that we need to address at large. Really appreciate your spending the time in the breakout session, kind of sharing what's been happening locally within your region. Let's go to the next slide. And we'll talk about what's coming next. So we had our kickoff session today. Again, we are going to post the materials and the recording, as well as a transcript of this session on the DHCS website. And then next week, we will have an office hours session, and the registration link for the office hours sessions were also sent out. But every week following the main learning session, there will be a 1 hour office hour session that'll be open forum for you to ask questions. What was on your mind after we had this Learning Collaborative session? What questions do you have about provider enrollment, for example, or about obtaining an NPI number? If you got your NPI number, what do you want to share with others about that process? And then we will continue our learning series. And the next session will focus on the screening portal and the short-term model. That is not going to be a how-to or screenshot by screenshot instructional guide on the short-term model. Those sessions will be happening on 9/10 and 9/12, so September 10th and September 12th. That's the more technical training on the screening portal. But in that session too, with this learning collaborative group, we will be talking about, what is the policy around the screening portal? How do you interact with it? What are the considerations for a short-term model? What are the considerations for pausing the activation of somebody who you turned on the aid code at intake prior to adjudication? Now they've been adjudicated or circumstances have changed and you need to pause their 90 days. And what does that look like? So we'll talk about some of those scenarios in our next full learning collaborative session on September 5th. We'll also have 2 sessions focused on services. So behavioral health services on September 26th. We'll dig more into the behavioral health links topic and what that looks like in terms of the warm handoff. But we'll also talk about the provision of medication-assisted treatment, as well as other kind of behavioral health services in the context of the correctional facility pre-release services, as well as the reentry supports and expectations for our county partners and managed care plans in that space. In session 4, we'll talk about non-behavioral health services. What are some of the other things besides case management that you can bill for? What are some of the scenarios? How do you provide treatment through physical health clinical consultation for members with hepatitis C, for example, or diabetes or hypertension, or members who are pregnant or postpartum? We will spend a whole session talking about enhanced care management for the JI population of focus and warm handoffs. And we really do think that that's a great place for your providers to help join the conversation. And then we'll have a session focused on pharmacy policy. So we know that you have questions today about pharmacy or ECM or behavioral health, but we will have sessions to address all of these topics. And this is the schedule that we are proceeding with. There's also going to be on the next slide, there's going to be other technical training opportunities. So I also already talked about the JI screening portal provider training. You see the dates and times here on this slide. There will be office hours following those sessions. The dates will go out on the Medi-Cal learning portal, and there will be additional information. You can click on the link that's in the slide to register. There's also a notice that went out, and you can search our Medi-Cal learning portal Justice Involved to find this information on the DHCS website. But it is linked in the slides, which we will send to you after the session today. And there will be the billing trainings. There's going to be one training series for embedded providers, so specifically for the county correctional facility entities and your contracted entity providers, your contracted providers. And that'll be on 9/17, 9/18, or 9/19 at the times indicated. There will be a separate session for in-reach or community providers in the fee-for-service space, including behavioral health providers. That'll be on 9/17, 9/18, and 9/19. And again, you can register for these trainings in our Medi-Cal learning portal. Let's go to the next slide. And we really want to continue the conversation, so we hope you join us for a future session. I hope that you found this session to be helpful. It was more of an overview. It's a kickoff. It wasn't meant to cover everything, but we'll really get into some of these topics. And our goal for this learning series is really to make this real for you. So what does this actually look like on the ground? And then what is it going to take? How do you help contribute to the conversation around best practices and implementation strategies so that we can all be successful on this journey together? Next. As always, you can send us questions to our CalAIM Justice Advisory Group. Our first office hours session will be next week, and we encourage you to sign up for all of these sessions. We think this was a good time for us to come together. Hope you found the value in it, and we will see you next week. Thank you so much for participating today and giving up your time, and we'll look forward to hearing back from you about how things went. Thanks, everybody.